Today, I'm really excited to be joined by my good friend Lenny Achan. Lenny is the president and CEO of Live On New York. He has over 20 years of leadership experience in healthcare. He's worn a lot of hats, and I think what's really incredible about him is he's worked in clinical care to leading digital transformation, managing crises, driving innovation. I still remember during the pandemic, he was running the war room for HSS. Just pretty incredible. He started his career actually as a medical ICU nurse before moving into executive roles at places like Mount Sinai and Hospital for Special Surgery. He's also a co-founder of Quality Reviews and serves on several nonprofit boards. Basically, if anything has been dealing with innovation in New York, Lenny's probably had his hands in it when it comes to healthcare. So Lenny, it's amazing to have you here and so excited to hear more about your awesome journey.
No, thank you so much for having me and appreciate it, but it's just great to see you again and just talk with you. I'll never forget our first meeting and the impression that you left and the great work you're doing. So thanks for the opportunity.
No, appreciate it. We wouldn't be here without leaders like you. So
Thank you.
right back at you. So I guess to start with, you started your career as an ICU nurse back in 1999, so pre Y2K.
Yeah.
What first drew you to nursing and kind of what made you eventually take that leap from bedside into more of a leadership role?
Yeah, so when I was 9 years old, we were at vacation down in Disney in Florida and on the way back to the airport to come home, got hit by a drunk driver, 85 miles an hour, no brakes.
Wow.
I was young, broke a lot of bones, got injured, ended up in the hospital. And long story short, for a couple days there, was being cared for in a great way. And the gentleman said, "Hey, I'm gonna, leave now. My couple days is over, and it's great to take care of you." And I was a kid, and I said, "Thank you, doctor." And he said, "Well, I'm your nurse." And it was like mind blown, like, boys are doctors and girls are nurses, and like what's going on here? And again, I was a kid, and it left that impression on me, but it left enough of an impression and planted a seed where I probably didn't really think about it again, other than that, just that moment that must have
Yep.
put a lot of um metadata in the back of my mind. But then when I was like 16, 17, getting ready and finishing up high school, reflected on that and thought, you know what, I want to be a nurse, and started moving towards my prerequisites, but had a long standing service need for community. My family was like that. Maybe I just grew up around it. Other than that pinnacle event, though, I think that was really it that opened my eyes to, you know what, anybody could be anything. And that's what I wanted to be. And I wanted to care for people.
Love that. I think to that point on care and compassion, I know in speaking with team members of yours previously, they've always kind of mentioned how you demonstrate that care and compassion. And I know even as people have moved on in their careers, they always view you as kind of one of the first people to talk to about what they're doing. How did your experience, I guess, in the ICU as a nurse shape the way that you lead today?
Yeah, so when I was an ICU nurse, I learned a lot about death and dying. I learned a lot about being able to, help people in crisis and including the families and communities around them. But the thing that I took away, and look, I'm a born and raised New Yorker. I've seen a lot. I grew up in the city, public school boy. I've seen a lot, lost a lot of friends, have been
Yeah.
subjected to a lot growing up. So it wasn't like a new lesson, but it was a more structured lesson on life that we all breathe, bleed, and are the same. We're the same, and we have to be kind to people. And don't get me wrong, I'm a business guy. Well, just
I
do.
learned that the hard way when I was trying to negotiate with
Yeah,
you.
exactly. And so it's not a mistake there. Broadly, I'm not gonna pretend to be a fluffy teddy bear per se, right?
Yeah.
To do what I've done and get to where I've gotten, but the premise of not forgetting why we're in healthcare and the DNA and true north. of keeping the patients at the center of it. Doesn't matter if you're a nurse, physician, administrator, executive, entrepreneur. If we could keep that true north, it's important. And then if you scale that, think about the echo effect of that, right? What's around it, the peripheral, it's the
Yeah.
people. It's the
Yeah.
people coming into the field, and you realize very early on that like one day you're going to be in that bed, your family's there, and
Right.
who do you want caring for you, and what can you do to make the place a better ecosystem,
Yeah.
uh, broadly, globally, but nationally and locally? What can you do that's reasonable? And that's all I've tried to do. I've tried to help
Yeah.
the best that I could in doing that.
No, I love that. I know my mom's an anesthesiologist, and she always taught me growing up, get to know the nurse because they're the most important person in the room. They're the ones that truly know everything about you. And to this day, whenever I meet a nurse that's like, I'm just a nurse, I'm like, no, you're not. You are literally the person that is interacting with the patient on a minute by minute basis, not even a day-to-day basis. And
Yeah.
care doesn't happen without them. So I
No,
think
and it's obvious through your DNA and what you've done that you've stayed true to that.
yeah, we're trying.
Yeah.
So I guess to that point, as someone leading change and innovation, like obviously I got to know you when you were at HSS driving innovation and change across the system. How do you balance kind of the big picture strategy of keeping while you're also keeping the voices of clinicians and those that they're serving at the core?
Yeah, so one thing within innovation, commercialization, or change, right? Just change,
Yeah,
because whether it's a digital device, whether it's tangible or any industry, brick and mortar, um, anything and everything, including what you've done through your voyage, all of it's about change and all of it's
yeah,
about challenging the status quo. And what you have to understand about that is that, very, very similar to an autoimmune disease, if you will, there is a strong reaction, a strong misunderstanding, a strong headwind
yeah,
that does not want change to happen because
right,
people have not yet perfected getting comfortable with being uncomfortable.
yeah,
And when you start to think about the reasons why there's this organizational autoimmune disease collectively, whether you're a startup pitching a hospital, whether you're inside, no matter what it is,
yeah,
if you're a nurse or an executive or even a CEO to a board, and vice versa, if you're presenting a new idea and it's the way that it's always been done and there's comfort there and security, what ends up happening is people aren't talking the same language. So in the mid 2000s, organizations coming in, as you know, I was the first client to a lot of the unicorns early on in helping
yeah,
them in, but the challenge there, the headwind was that the language being spoken wasn't the same. If
right,
you're a company coming in with a digital health in 2008, 9, 10, and you're talking to a C-suite of a hospital and you're saying, we're risk takers,
yeah,
willing to fail. This is how we learn, and this is how
right,
we iterate. You've got legal compliance risk, a CEO, COO, that's traditional. They don't, they hear, go, stop this, go away. How
yeah,
do we get these people out of the room? When in fact, they're, they need a translator sitting at the table. And that's
yeah,
what I
love
tried to
that.
be, right? I always had a foot in and a foot out of the community. And what do they need? They need a translator. They need a diplomat. They need an
Yeah,
anthropologist. They need an ethnographer. They need people who understand that all of those things need to bring people together to say, wait, they don't mean risk in a fashion that we're used to every day, clinically caring for people. They mean the iterative and entrepreneurial process of XYZ. Oh,
right,
right. So that's where that big, clash came in. And that's what was so difficult in the experience of seeing a lot of early stage companies and a lot of great ideas go to the graveyard out of ignorance. So what is our job? Our job, and we've come a far, far, far way. Our job's to stand in the fray. Our job is to be bold enough as insiders or outsiders to say, hey, this is what I mean. Hey, time out. Hey, pause. What
yeah,
I really meant was. But understanding that before you get in the room is critically important. So that was always my DNA as an intrapreneur, as an
hmm
entrepreneur, as a change agent. I had to go up against that, and it's traumatic. It's
yeah,
traumatic. So you then, you feel for anyone trying to do it and try to help them live vicariously through your mistakes and
Yeah.
say, hey, before you make this mistake, hey, here's what you do. And I would prep companies. I'd talk to founders. I'd say, hey, these are the 5 words that you shouldn't say. If you do, let them
Right.
speak. And it worked. It worked.
Yeah. No, I think that's so important when you talk about the translator. And look, hospitals want to say they're innovating, but also I always tell people if you're changing Microsoft Excel, you create a new version of Excel and it crashes, like the worst thing is you've lost like half an
Yeah,
hour of work. If you do something in a hospital, the worst thing could be someone actually dying. So the implications to your point on compliance and legal are just so much higher. And so people need to remember that when they're talking to hospitals and pitching.
absolutely.
Um, and I know you, as you kind of alluded to, you've been very good at being one of the first movers and always serving as as a happy reference, right? So I remember you were my best friend from high school's first customer, and you guys had a ton of issues, and yet you were their reference, and now they're still around because of a lot of the reference calls you guys did for them. So.
Thank you.
No. So you kind of alluded to it, but what are some of the biggest challenges that you face when trying to drive innovation through healthcare?
Um, it's really again just understanding the audience,
Yeah,
understanding the problem and the solution, and then being able to effectively communicate that. A lot of it is communication breakdown. A lot of it is fear and anxiety of taking some risk on to change the world.
yeah,
So, we just talked about, a lot of it comes down to some basics of, all right, what's the problem that they're trying to solve? Do we solve it? Are we a vitamin or a painkiller? You know,
right,
um, and if we're a vitamin, we might need a different approach and might get disappointed. If we're a painkiller, hey, we better go in there with confidence and explain the rationale and thesis as to why we could solve the problem that's a pain point for them to help them make that pain go away. That's like the tip of the spear.
yeah,
And then, you better have a great product and a great team. It's okay if all of that's true and they say no,
right,
and move on. But, in guidance, it's really effective strategy, communication, honesty and transparency, especially up front. Um, and really, who's your buyer? Because every organization, as you know, has a different title. One, it
yeah,
might be the COO, and one, it might be the CNO, and one, it might be the CIO. And sometimes a lot of companies make a approach to the market or a sale that's based on a role, but they don't try to find out who's actually the signatory and the decision maker who has
right,
influence in the room. Regardless of the idea, if you don't have those things straight, you've probably, failed before you got in, or
right,
you will be deceived into a 3-year sales cycle before they say
right.
no.
Yeah. No, that's so true. And I think it's, to your point, finding the decision maker, but also finding the key influencers of, like, I know you always had us speak with nursing because for us, our products were needing the nurses to really get behind it. And so finding the people that are going to be the loud voices in the room saying, no, we absolutely need this. So I
Exactly.
think taking it on the other side and from your journey, for nurses or clinicians in general thinking about stepping into a leadership role or trying to drive innovation, what's one piece of advice you wish you had gotten early on?
Don't take it personal,
Yeah,
and you know, just don't compromise ethics or integrity, right? Don't compromise that. Keep that true north. Don't take it personal. Um, and there's doing the right thing and there's doing the easy thing.
yeah,
And there are differences between those things. And if you could keep those in the back of your mind and remember, why'd you get into healthcare in the first place? And even if you just wake up once a week or once a day, when you wake up, if you could be reminded of that true north, and hopefully that is the true north that started to guide you, it'll carry you through your whole career. I mean, I've done 15, 16 different roles. I check myself on a regular basis. I've never left the patients. I've never left the community.
Yeah.
I've just been able to scale what I could do to the best of my ability and failed a ton of times to get there.
Yeah.
Yeah.
No, it's the quote of like, if you don't fail, you don't succeed, or I think the gym in Chicago when I went to business school was like, I didn't fail 99 times, I just learned 99 ways not to do it.
Yep.
Um, so I think to your point, you continue to do amazing things, and now you're leading Live On New York, which is such an incredible organization. Can you share a bit more about what you all are doing and the impact and goals?
Yeah, sure. Livon is a organ procurement organization, one of 56 in the United States, a federally designated organization. And what that means is that we have a donation service area, 5 boroughs, Nassau and Suffolk County, Westchester, Lower Hudson Valley. What does that translate to? It means that we have the privilege and responsibility of working with about 100 hospitals in the region, and we are responsible for honoring families or organ donors' wishes to give the gift of life to others.
Hmm.
There's there's three ways that you can become an organ donor. A living donor, somebody who gives that gift while they're still alive, like a kidney or part of a liver, you might have heard of, but also signing up on the registry to become a donor or your family authorizing it.
Right.
And our job is to, when the moment comes that somebody is voiceless, that somebody has passed away and has chosen to give the most precious gift they can to someone on the wait list, to give them that opportunity to see that through. It's incredibly complex. It's
Yeah.
truly more of a logistical business than healthcare and a human integrity and human rights organization. It's that final will and testament that's not the car, the house, or the money, but the most precious gift that you could give to have a legacy and also help people live on. That's what the organization is. What we do, we're responsible from everything from holding the hand of the family member or loved one through giving the opportunity, asking the question, do you want your loved one to be a donor if they're not already? And we don't, it's not a required yes. We just want to ask the question and then let
Right.
somebody have the opportunity to answer. Our staff is the staff that goes to the ORs when that time comes to procure those gifts of life after somebody has been declared dead, passed away. And then all of the logistics management and working with the wait list and variables to get that gift to the sickest person on the wait list anywhere in the nation. Livon traditionally was not a high performer here. They were one of the lower performers in the country. I was asked to come and look and, try to turn the place around, which we're continuing to do, but have done and are now a leader in the nation in that regard, a little more than 3 years later. What does it all translate to? A few thousand people's wishes honored and
Yeah.
over 4,500 people whose lives were saved thanks to the entire ecosystem. And there are questions, challenges in the market right now. It's a broad topic across the board. There's appropriate scrutiny looking at the system as a whole to make sure that it works.
Yeah.
And that started many, many years ago. And it's, part of the reason that myself and the team were brought in by the board to look at the system and try to turn things around.
Amazing. And for anyone that wants to, any of our listeners that want to get involved or donate, where can they go to do that?
Yeah, you could go to the National Registry if you want to sign up to be a donor, or the state registry or DMV, even voter registration now. But if you just want to learn more and that's what we encourage, just you could go to liveonny.org, or you could, just search and you're gonna find a lot of stuff. And like what we encourage people to do is read it all,
Yeah.
believe it or not, make your own determination of what you want for yourself or what you'd want for your family and have the conversation, and that's what it's really about. It's about giving everyone that opportunity to have a legacy and help others in the community who are hoping that somebody would step up or not. And so yeah, just look it up for yourself, make your own determination and figure out if that's something that you'd like to do.
Perfect. And then lastly, as a native New Yorker, Yankees or Mets?
Oh boy, well, My family are all Mets fans, so I'll say Mets. I'm not a big
Love to hear
sports.
that.
Yeah, yeah. So
If you had said Yankees, I was just going to hang up immediately.
by marriage and by proximity, that's what I have by default.
Love that. Awesome. Well, Lenny, thank you so much
Thank
for
you.
taking the time with us today. It's always so great to speak with you, and I know it's so incredible the work that you all are doing, and excited to continue to see the amazing work that you all do.
You as well. Thank you for the opportunity and advocacy. I can guarantee it'll help somebody out there, hoping and praying for someone to step up. So we appreciate you. Thank you.
Yeah, no, of course.